Learning disability psychiatry is the branch of psychiatry where we're dealing with people who have a learning disability and a comorbid mental illness. So a learning disability is a developmental condition which starts usually in childhood, sometimes due to genetic disorders, sometimes environmental factors. A learning disability is more than something like dyslexia. What we're talking about is people who have a global developmental delay associated with an IQ below 70. That impacts on all areas of functioning, including social and educational aspects of development. As a learning disability psychiatrist, you'll find that you can work with people over a long period of time. I think probably more than other specialties. That's definitely an attraction. People with learning disability face a lot of discrimination in society, sometimes in accessing healthcare. So one of the things I find is that I'm often advocating for them. And I think people who have this sense of wanting to help people who are underprivileged in society will probably be drawn to a career like learning disability more than some of the other branches of psychiatry. In learning disability, I find that we have to work very closely as an MDT, and that really helps to improve the outcomes for patients.
I think it is fairly unique actually, the level of the collaboration and the level of the joint MDT working. I've not come across that in other types of services before.
As an MDT you get to work with physios, occupational therapists, nurses, the behaviour support team, and then also working across multi-agencies, so you're working with private care homes, the care providers, you work with social workers, and you have to work with a whole range of different peoples and specialties.
He's got autism, he's got short-term memory loss, which is what we've sort of coped with since he's been born. When he was 19, he started to suffer from schizoaffective disorders, which then had a big impact, more of an impact in his life than his learning disabilities, and that's when the psychiatry is invaluable.
The training in psychiatry around the West Midlands is fantastic, and the learning disability scheme here is one of the biggest in the country.
I was interested in staying in the West Midlands because we have a large training scheme for intellectual disability, and as a higher trainee I'm currently completing a postgraduate certificate in medical education, and there have been bursaries available for several trainees in the West Midlands. I would really encourage you to consider this speciality because it gives a unique experience to work with a really diverse patient group in a range of different settings, whether that be forensic, inpatient, the community.
If I was younger, I would go into it myself because I think it's massively important.
If I was starting out today as a young doctor choosing a career, I would still choose psychiatry, and if I was a psychiatry trainee, I would still do learning disability. So I hope you'll come and join us in the West Midlands and do psychiatry here.